Afrin spray is an alpha-adrenergic stimulant for topical use, has a vasoconstrictor effect. Active ingredient oxymetazoline. Oxymetazoline causes vasoconstriction of the mucous membranes of the nose, paranasal sinuses and eustachian tube, which leads to decrease in the edema and the release of nasal breathing in allergic and/or infectious inflammatory rhinitis. Indications: difficulty in nasal breathing with cold, inflammation of the sinuses, eustachitis, hay fever, allergic rhinitis, congestion and swelling of the conjunctiva. How to use: intranasally. Shake the bottle vigorously before each use. Before using the nasal spray for the first time, it is necessary to calibrate it by pressing the spray head several times. Adults and children over 6 years old, 2 to 3 injections in each nasal passage with an interval of 10 to 12 hours. In adults, the frequency of use can be increased up to 3 times a day. It is not recommended to exceed the indicated dose. Contraindications: hypersensitivity, atrophic rhinitis, simultaneous use of monoamine oxidase inhibitors, including a period of 14 days after their withdrawal. Children under 6 years of age. Carefully: coronary artery disease, arrhythmias, chronic heart failure, severe atherosclerosis, arterial hypertension, hypothyroidism, thyrotoxicosis, diabetes mellitus, chronic renal failure, ankylosing glaucoma, prostatic hyperplasia with clinical symptoms, pregnancy, lactation. Special instructions: with prolonged use, more than 1 week, it is possible to resume the symptoms of nasal congestion. If you need to continue treatment for more than 5 days, you should consult a doctor. It is necessary to avoid getting the drug into the eyes. The drug slows down the absorption of local anesthetic drugs, prolongs the time of their action. Combined use with other vasoconstrictor drugs increases the risk of side effects. Side effects: local reactions, transient dryness and burning of the nasal mucosa, dry mouth and throat, sneezing. With prolonged use, tachyphylaxis, reactive hyperemia and atrophy of the nasal mucosa. Methylconium chloride, which is part of the drug, can cause local skin reactions. Systemic reactions: increased blood pressure, increased anxiety, nausea, dizziness, headache, insomnia, palpitations, sleep disturbances.